KM हॉस्पिटल पुणेतर्फे फिटल मेडिसिन या विषयावर राष्ट्रीय परिषदेचे नुकतेच आयोजन करण्यात आले होते. प्रसूतीपूर्व निदान, गर्भावस्थेदरम्यान उपचार आणि विशेष उदयोन्मुख शाखेच्या या रूपातील फिटल मेडिसिनचे वाढते महत्त्व यावर तज्ज्ञांनी मार्गदर्शन केले. गर्भवाढीदरम्यान उद्भवणाऱ्या विविध समस्या, जन्मजात विसंगती, अनुवांशिक विकार, प्लासेंटाच्या कार्यामध्ये असणारा बिघाड अशा अनेक स्थितींचे निदान लवकर केले जाऊ शकते व त्यावर लक्षित उपचार देखील करता येतात याविषयी माहिती या माध्यमातून देण्यात आली. यावेळी फिटल मेडिसिनमधील प्रख्यात तज्ज्ञ डॉक्टर मणिकंदन कृष्णन, मेडिस्कॅन सिस्टीम डायग्नोस्टिक अल्ट्रासाऊंड फिटल मेडिसिन अँड ट्रेनिंग सेंटर चेन्नईचे संचालक डॉक्टर सुरेश शेषाद्री यांसह अनेक तज्ज्ञांनी यावेळी मार्गदर्शन केले. या परिषदेला स्त्रीरोगतज्ञ, रेडिओलॉजिस्ट व फिटल मेडिसिन तज्ज्ञ मोठ्या संख्येने उपस्थित होते.
Started this department 10 years back, and today we are here with whatever we have done in last 10 years, and we are still planning to have many more advanced therapies or options available in future also. In one line I can tell you what is fetal medicine. It is like clinical examination of the fetus. Means the way we examine adult patients with the help of stethoscope, in fetal medicine we examine the fetus with the help of sonography machines probe. Because we need to examine the fetus, find out the problems, and accordingly plan the management and give best possible outcome to the patient. Sometimes it is only like extending the pregnancy to maximum possible pregnancy weeks. Sometimes it is doing some intervention till the baby is inside the uterus, so that whenever the baby will be delivered, baby should be in best possible conditions. And I am actually thankful to all my colleagues as well as KM administration for supporting all of us to reach this level, and I am sure that they will continue supporting us in future also.
Make one or two key points. What is this fetal medicine and what is ultrasonography? Everybody hears about sonography. So part of it is just one and the same thing, and fetal medicine covers pregnancy ultrasounds, but at a sort of much greater depth. That does not mean that your standard ultrasound is of poor quality or anything of that sort. It is just looked at in a much closer manner, and there is much more interaction with the obstetrician in these cases. So they work in two spaces. One space is identifying any problem, small or large, as early as possible, and unfortunately, some of these problems might be such that one can't do anything about them, in which case maybe, unfortunately, the mother might have to terminate that pregnancy. But look at it this way, that something of this nature missed at that point, and a person eventually ends up with a delivery which could have disastrous consequences. There might be fetal loss before the end of the pregnancy. Post-delivery, there might be problems which are incompatible with life, and the baby might not survive. And think of that trauma that the mother has to go through that whole pregnancy because something might have been missed. Then the second part of what you're looking at is of the things that are picked up. Some of them are treatable. We are not God here. There's a sort of limits that we have to what we can do. But there are some interventions now that are available. And this can only happen in an area which has, first of all, a very well-established high level of sonography capability. And that's not only machine, the operator is that much more important possibly. And these interventions, some of these things have to be corrected intrauterine. That means when the pregnancy is ongoing and not after delivery. So these are the other kind of issues that fetal medicine addresses. But the third thing is also maybe looking at this presentation, it may not come out so much, is that even in a ongoing pregnancy, which is normal in all other terms, that there are a lot of pregnancy-linked issues that can creep up. BP going up, hypertension in pregnancy, that is, then sugar-linked issues, GDM, gestational diabetes, over diabetes the mother might be having. Mother might be having any other kind of medical comorbidity that she's carrying. So in a lot of these cases, then monitoring of that fetus is very critical, and timing of delivery is also something very critical. So the experts here help us time deliveries well, because between having fears and doing a delivery very early, where the prematurity element is large, towards pushing the pregnancy too far to the end to remove the prematurity problems but ending up with other kind of problems. So it's a very fine balancing line. And here we do not get time. There are many illnesses where you can say you have even a few weeks to think over, 1 month to think over, and say, okay, this is the modality, that is the modality. This is a very dynamic situation. Sometimes even 24 hours, 48 hours, the whole complexion changes. And that is where this specialty comes into play. So at the KEM, actually, obstetric ultrasound has been pioneered in Pune by KEM Hospital somewhere in the mid-1980s, where there were hardly any machines available. And from that to this point, there has been a huge journey. Equipment, instrumentation, everything has changed so much that makes it possible to detect things which we couldn't do even maybe 10 years earlier. And especially the treatment modalities that we can offer, that is a sea change between now and a couple of years ago. And this affects maybe a very small percentage of pregnancies. But I don't believe we can say that it's a small number, let that get ignored, let those people suffer. Because if you can have some kind of intervention which gives a good outcome, I believe that we should provide that at least. And at the KEM, that is what we are trying to do now. And also that some of these interventions are extremely expensive. And we try to keep those rates also as affordable as possible, which is quite in ethos with the rest of the KEM hospital, where rates are sort of far less as compared to that kind of tertiary, quaternary kind of centers.